He's a new doctor in one of Canada's poorest neighborhoods, known as Park X, which has high rates of COVID-19.
I'm not going to lie, I definitely feel almost defeated at times.
Asylum seekers and recent immigrants are a big part of Sherwani's practice. Most patients consult with him over the phone, which is a struggle, not just because of language, but trying to diagnose symptoms when he can't examine his patients.
Now what I'm seeing is when people are consulting with abdominal issues, is that I'm going straight to ordering ultrasounds, straight to ordering blood tests, and I know that's also a strain on the system.
Remote family medicine has improved access to healthcare for some, but this psychiatrist who treats other doctors says many are more worried than ever about their patients.
Just to get those nuances that, would be much readily seen in person, but you don't want to miss anything. You want to make sure that you fully understand what the patient is saying without the help of all the body language you would have in the office.
An even bigger challenge when patients are elderly, like this doctor's.
She's crying. Mood-wise, how do you think she is?
Dr. Iris Gorfinkel says she's also sending her patients for more frequent tests and referrals. And wait times for x-rays, ultrasounds, and blood tests are getting longer. That's on top of the long-term needs of some COVID patients.
Instantly, you're referring to a cardiologist. You're referring to a respirologist. Like, do the math in your mind of what's happening. They may have some blood problems, so it could be a hematologist. If they've lost their sense of smell or taste, you're talking about a neurologist.
Which often leads to more tests in a system that's already taxed.
Blood test requisition.
Vic Adopia, CBC News, Toronto.